My name is Dominic Lucia, Dominiclucia, MD. I'm a pediatric emergency physician, and I'm also the Chief Medical Officer of McLane Children's Hospital.
And can you just tell me right now, overall, what you've been seeing with COVID cases in kids and hospitalizations in recent weeks?
Yeah, we've seen the positivity of kids go up immensely over the last couple weeks. And then hospitalization-wise, we've also seen kids with COVID that are being hospitalized. Certainly in our hospital, that percentage has crept up rapidly in the last 10 days to 2 weeks. We were around 1 to 2%. And then today we're closer to 10%.
To 10%.
10% of our hospital, it's actually closer to 12% of our hospital beds have COVID positive patients in them today.
Kids, of course.
Yes, we're a pediatric hospital, 17 and under.
And then can you tell me, the kids that are being hospitalized, do they have underlying issues? I guess, who are the kids being hospitalized?
Well, that's a great question. It's a variety of kids. And so without relaying, individual medical information, it's generally a mixture. It can be kids that don't have a lot else. We've seen some younger kids that have the sort of those significant viral symptoms that actually need some help as far as breathing. And we see it also with kids with complex medical histories where it causes more problems. So it's a variety of kids right now. And what we've seen, especially with Omicron, is the spread is just very, very easy for this virus. And it affects you, and you can get it whether you've been vaccinated, whether you've had COVID, whether you haven't. Really, what we do see, though, is those that have been vaccinated, especially those boosted, when you talk about older kids and adults, are doing much better safety-wise as far as not having to enter the hospital, having much shorter courses of illness.
I was going to say, so the kids who are vaccinated are maybe less likely to be hospitalized or are doing better in the hospital?
Yeah, I think that's fair to say. Less severe illness if you're vaccinated, especially with the 2 doses, which is all that kids under 16 can get.
And if Omicron, a lot of people said Omicron, has less severe illness. I guess, why are there more kids ending up in the hospital? Just because more people are getting infected?
Yeah, I think that's it. I think that there is probably less severity overall. I think it's a little bit early to say how exactly it's going to affect the peds population, but certainly we know more kids have it in general. So then the ones that are going to have a tougher time with it obviously are getting it, and those are the ones getting hospitalized.
And then with kids going back to school here in Austin next week, what advice do you offer parents? I know a lot of parents are trying to keep their kids safe. How should they help protect their kids when they go to school?
Yeah, that's a great question, and something we're obviously worried about given the state we're in right now. I will say, for the record, we want kids in school. We think they learn best and do best socially there. That being said, with this high viral zone time of not only COVID, but flu, metapneumovirus, rhinovirus, all really heavy right now. I think the things that we've learned, the common sense measures, first and foremost, if you're 5 and up, eligible for the COVID vaccination, get it. If you're eligible for flu vaccination, which essentially is all ages, get it. And then the secondary measures, which are important right now, which would be the masking, which would be the hand washing, which would be the social distancing. These are all things that are going to keep the kids safe, the teachers safe, our family safe, and our community safe as we possibly can through this rough time.
Now, I know in a recent email, Austin ISD had encouraged parents to double mask their kids. Do you think, I guess, that's necessary, or what type of mask should they do? Should they double mask?
Yeah, I don't know the exact reasoning behind that. I don't think it would hurt. I think if we can just start with a good quality, mask, medical mask with the elastic, that's a really good start. Further protection by further layers makes lots of sense when you're talking about droplet spread, but I can't comment on that recommendation specifically.
I just have 2 more questions, but obviously we saw this huge increase during winter break when kids weren't even in school. So, what do you think with kids going back to school? Do you think that could hurt the situation, help the situation?
I think we're set up that it's going to be pretty robust as far as the numbers go as kids go back to school. So January is probably going to be a very challenging month as far as illness just in general, because typically we see a little bit of a downtrend in viral illnesses during the Christmas break in kids, and then it goes back up when school gets back in. So where we're at right now during the break, and then we're going to go back to school, it's probably going to get worse before it gets better.
And I guess just going forward, I mean, you've probably been through a lot the last couple of years. What is your hope as we enter the new year when it comes to COVID?
Well, I hope that we can avoid having these big waves of morbidity and mortality that we've seen certainly with Delta as we move forward. And I think that starts by us using the tools that we have available to us that we've mentioned, the vaccinations, the secondary things as far as masking, hand washing, and distancing, especially during these big waves. And we're right in the middle of one right now.
And then last question, just as you have so much insight that a lot of our viewers and people like me, don't have, what else do you think is important for people to know about what's happening right now?
Well, one thing, and I sort of alluded to it earlier, is those measures that I talked about can protect us from a lot of different things. So when you talk about, sometimes people will say, well, it's COVID, and if my kid gets it, it's not a big deal. Unfortunately, it can be a big deal, even if it's mild symptoms up front. Our pediatric infectious disease experts are seeing kids that have long haul COVID symptoms and can have other issues secondary to COVID even weeks later. So it's probably risky assuming that if they just get it, they'll be okay. So in that same vein, we need to do the things that we can do while we can do them to help prevent it, which is the vaccines, the masking, the hand washing, and social distancing. It's all about taking care of our kids, our families, and our communities.